Good morning, Nava. Very nice to see you. Could you please introduce yourself?
I will, thank you. My name is Nava Gelkop. I've been a PT for 26 years. I trained at Tel Aviv University in Israel for my first degree, in London, UCL for my master's degree, and currently I'm a doctoral student in Haifa University looking at participation in children with CP and CVI. I'm working in a school for children with visual deficit and CP, and for the last 6 years, I've been the chairman of the Israeli Association for Child Development and Rehabilitation.
Thanks, Nava. That's very nice. It means that you are both a clinician and a researcher. And you know, we are talking now because you've read this book, the book on early detection and early intervention. And I would like to ask you some questions about the book. And the first one is, what did you like especially about the book?
I like the book very much. I think the book succeeds in closing the gap between the neurodevelopmental theory and clinical practice. I also think that the book encourages and inspires the readers, the health professional team, to continue developing their knowledge in a similar way. All writers, especially you, Mijna, as a writer and the book's editor, have a long personal experience in clinical and research field. You are all emphasize and expand the knowledge about the mutual impact of the various aspects of development, from emotional, cognitive, sensory, and motor development, and more. And I think the book represents the change in the neurodevelopmental therapy model and the influence of the ICF. It starts from neurophysiology, understanding body function and structure, through improving activity, towards the shift in participation through environment adaptations. And me, as an authorized service accessibility and COPCA educator, I see this as the right way to approach children and families in rehabilitation.
So thanks a lot, Nava. I'm really happy that you appreciate the book so much. And as you appreciate, perhaps my next question is, would you recommend the book to colleagues? And if you would, why would you?
Because I think it is the only updated book that gives a depth overview of early detection and early intervention in developmental motor disorders. And it is noticeable from the different chapters of the book, the summary points, the written text, the photos, and the referral to videos that are free to watch, that the writers want us to learn and give us the tools to deliver a better neurodevelopmental intervention. It is easy to read, practical, bringing evidence-based knowledge from leading clinical experts, and it approaches both clinicians and researchers. And this is why I recommend that all my colleagues buy and read the book.
Thanks a lot, Nava. And you know, when you write a book, you hope that people will appreciate it. And we really wrote it to help the professionals in the field to serve the children with developmental neurodisabilities. So thanks a lot.
And thank you.
Hello, Rosane. Very nice to meet you. I'm Mijna Hadders-Algra from the University Medical Center in Groningen, and I'm the editor of this book on the early detection and early intervention of developmental motor disorders. And I now have a conversation with Rosane about this book. And Rosane, I think, will first introduce herself.
Okay, thank you very much, Mijna. I'm Rosane Morais. I'm a professor in the physiotherapy department at Brasília Federal Public University. And I have been teaching and work in pediatrics for over 20 years.
Thank you, Rosane. So you have a large experience in the field of pediatric physiotherapy. And now my first question is, what did you like especially about the book?
Yes, it's a very nice book, not only for the excellent layout, which makes the book enjoyable to read, but also because they very up-to-date content, written by the great authors, by the way, but at the same time, it's very simple and easy to read.
Okay, I'm very happy to hear that. And having said that, what would you recommend the book to your colleagues? And if you would, why would you do that?
Yes, for sure. I have already been recommended it. It addresses topics since the neurosciences basis to aspects of participation, but in a simple way. So it's just perfect for professionals who work with early detection and intervention.
Okay, thanks, Rosane. That's very nice to hear.
Thank you.
Thank you. Hello, Taryn. Very nice to see you. Could you introduce yourself?
Yes, my name is Taryn Liu. I am an assistant professor in pediatric neurology at Loma Linda University Children's Hospital in Loma Linda, California, in Southern California. I focus my practice on neurodevelopmental disabilities, particularly working with children with autism spectrum disorder, but also helping to identify children at risk for cerebral palsy, working in the high-risk infant clinic and the high-risk infant rounds.
Okay, that sounds a very interesting job, Taryn. And we are discussing now because you mentioned that you read the book on early detection and early intervention. And so I would like to ask you, what did you like especially about the book?
Yeah, I most appreciate the book for the focus on family-centered care, in particular, that humanistic language used in incorporating biological and medical aspects of conditions and how they impact the daily lives of the individual with that developmental difference. And I appreciate the stress on early intervention, not as a means to fix a problem per se, but to optimize and empower the child and their family to assist in reaching the best potential of the child. In nearly every single chapter, you bring the family and the child's well-being into light, and I very much appreciate that.
Thank you, Taryn. Yes, I think that is one of the essentials of pediatrics and developmental care. And would you recommend the book to colleagues? And if you would, why?
I have, and I will continue to recommend this book to colleagues, not only within the child neurology subspecialty, but within several interdisciplinary specialties, including pediatrics and physiotherapy. I appreciate the evidence-based yet practical information and language used to describe these complex developmental concepts. And I feel that the analogies used are very relatable to a wide variety of people and professions. And I think that one of the takeaway messages that I particularly enjoy, and I think all physicians and early intervention specialists should know, is the message that you use that every child deserves early intervention when necessary. So I very much appreciate that, and I have been recommending this book.
Thank you very much, Taryn. That was wonderful.